Let's take about 5 minutes and talk about the Health Tech Investment Act. This legislation, which was recently introduced in Congress, aims to establish consistent and predictable Medicare payments to providers using AI-enabled medical devices. Why is this a good thing? The proper adoption of AI-enabled medical devices into medical practice will improve patients' access to cutting-edge technologies. Hi, my name is Peter Weems. I'm the Vice President of Government Affairs and Policy Strategy for AdvaMed's Medical Imaging Division. Digital medical technology over the last 20 years has brought amazing advancements, and AI-enabled medical devices that are authorized by the Food and Drug Administration and used by healthcare professionals are poised to offer patients even better diagnostic and treatment options. And the faster, more precise, and more efficient, the better. Because these technologies can positively impact people's lives and their ability to recover from a disease or injury. The potential for AI to transform patient care is immense, and its role in radiology offers some of the most compelling examples. Already, AI-enabled technologies are supporting healthcare professionals by helping to interpret medical images quickly, efficiently, and above all, accurately, aiding in the early detection of diseases and ensuring that patients receive timely and definitive diagnoses. From helping a physician identify polyps during a colonoscopy, to prioritizing scans for emergency interventions, AI in medical imaging is not just a technological advancement. It represents a huge improvement in diagnostic care. But it's not easily available to everyone yet. AI adoption faces significant barriers due to simple issues like inconsistent reimbursement. Only a very small number of FDA-authorized AI-enabled medical devices currently receive Medicare reimbursement. It's a problem, but it's one that we can fix. Here's an easy way to think about it. For a medical device to be used, it must first be deemed safe and effective by the Food and Drug Administration. And then health insurers, the largest being Medicare for our nation's seniors, must reimburse providers for using the technology. But providers don't want to invest money into buying a new piece of medical technology without first knowing whether they will be reimbursed for using it. And it's this uncertainty that slows, or completely stalls out, a medical technology's ability to make it into care. The Health Tech Investment Act, if passed into law, would create a clear and consistent pathway for Medicare reimbursement, enhancing patient access to cutting-edge, AI-powered medical devices. This is why Congress is acting, because it can and will help patients and those advocating for them. The Health Tech Investment Act would guarantee that AI-enabled medical devices receive stable payment from Medicare for 5 years. This will provide a strong foundation for reimbursement policy into the future and give doctors confidence to onboard these technologies without fear of dramatic payment cuts. It's a simple solution to a complex problem that impacts patients' ability to receive cutting-edge diagnostics and treatments. The Health Tech Investment Act has great momentum and is supported by a number of leading patient groups, including Patients Rising. We're excited to work with you to let Congress know that patients deserve access to the latest AI-enabled medical tools to enhance diagnostic accuracy and improve patient outcomes.